I'd like to welcome Dr. Zwigenbaum back up to the stage here to talk about nouveau treatments in autism, after which we will have a question period for both Dr. Nicholas and Dr. Zwigenbaum. I'm sure there are questions. So hang on to those, write them down if you need to, and we'll definitely have some time to go over those questions.
All right, but we'll shift gears a little bit to talk about an area that makes, that I actually was sort of very intimidated taking it on. It really is to the credit of the organizers and to all of you that I think one of the priorities of this day is to be responsive to feedback from people who attended the previous year. So Lori and the group always kind of open it up to previous attendees about what topics would actually bring you out, what would actually be interesting to talk about together, even if it's not directly linked to a particular project that we're working on. This kind of notion of nouveau treatments, so I think speaks to this sort of broader concept of complementary and alternative treatments. Now, I have to say that the distinction between the conventional and the alternative, I think, has really become quite blurred. And often it's like who has the podium and what gets to be called conventional or not, because we recognize that a lot of the emerging treatments have roots in biology, may actually be very effective for people on the spectrum. And we recognize that this is a bit kind of fluid, that there's new evidence and kind of new research and individual experience that's emerging all the time. Some of the so-called conventional treatments, especially the ones that aren't anchored in education and sort of face-to-face intervention, are, the evidence is not necessarily so great. So it wouldn't make a lot of sense for me to talk about conventional prescribed medication as conventional and some of the emerging treatments as not conventional, because the evidence for some of the medications we prescribe is also kind of emerging and evolving. Just to kind of help highlight this point, I wanted to ask the general question. So for people here who are on the spectrum or supporting family members on the spectrum, how many of you have sort of considered sort of this broader range of complementary and alternative treatments, kind of supplements, diets, so on? Either consider for yourself or at least have questions about it. So a lot of people in the crowd. So of those of you with your hands up, how many of you actually felt comfortable talking about your questions and interests with your medical provider, like with your community doc? So many fewer hands. And of those people that raised your hand that you would actually bring these questions to your community physician, how many of you actually felt that they were knowledgeable enough that you would take their opinion seriously? Great. So it's encouraging to see some hands, but even fewer. And I think this kind of really highlights the dilemma. So first of all, someone like me needs to get over their anxiety to be able to sort of have this conversation. And I think it really speaks to the whole relationship between physicians and clients. People in the community seeking healthcare has really changed. So for instance, I don't have any exclusive access or expertise around this broader range of treatments. In general, medical providers don't have this kind of exclusive access to information about treatments and evidence and research. I mean, it's broadly available. You can kind of search up Dr. Google and find out sort of the latest and greatest. I mean, I think there are real challenges in terms of filtering different levels of evidence and quality of information and what's kind of glossy but maybe more kind of commercial, or people that are kind of out there more for financial reasons and sort of, who are promoting products sort of that are more established and sort of more motivated out of the well-being. And often, as you know, it's not so categorical. It's often somewhere in between. I mean, often, whether conventional or non-conventional, there's a for-profit element of these treatments, and yet these treatments may still be very helpful, and people may be motivated by the well-being of their clients. I think the second important thing is, as a physician, I'm also not the gatekeeper to these kinds of treatments. So we'll be talking a little bit about medical marijuana and its byproducts and stem cells and diets. And the truth is, for individuals and families who access these types of treatments, they are typically not through their family physician. There are other routes potentially to access these types of treatments, and it speaks to sort of very different relationship between a community physician or even a specialist and a client. It's less about this kind of historical, the doctor kind of sits and delivers their wisdom and kind of gives advice about what people should take or what people should not take. And it's actually much more of a partnership. It's about having a respectful, bidirectional conversation, sort of recognizing that both partners bring something to the table. And in a sense, the medical professional, their role is not as a gatekeeper, but rather to support individuals and families in making informed decisions, sort of helping them have access and be aware of information about what seems to be helpful and what the risks may be, but also respecting their role as decision makers. So it's in the spirit of that I'll talk about some of these emerging treatments. So as probably all of you know, marijuana is legal. Canada is open for business for marijuana-related products. It's a very different situation for adults and for kids, though. It's important to know that there are actually only two indications for medical marijuana for people under the age of 18, and they're not necessarily what you would think they would be. So the first indication is for severe, otherwise untreatable pain, and typically sort of associated with cancer or malignancy. And the second indication is for severe or otherwise untreatable seizures, kids that are having convulsions despite best efforts at medical management. At this point, there aren't any specific indications around things like behavior or emotional health or sleep or other things that are where medical marijuana has found more of a place in adult medicine, and probably behind the scenes that there are some kids that are receiving marijuana-related products. There is actually, we have a relatively short history of where we have this sort of broad access to marijuana, and even much longer history than the notion of medical marijuana. And of course, marijuana has also been used as a recreational drug, and there's actually been lots of concerns about kids who use marijuana in terms of effects on learning and attention, risk of serious mental health conditions such as schizophrenia. So it's a different landscape now, sort of recognizing that there may actually be sort of medicinal qualities, but it is against this backdrop of concerns about risk. One of the huge sort of elements to this conversation is that marijuana isn't just one thing. And the idea that there are sort of multiple active components in marijuana, and there are two main ones. One is THC, which is essentially the kind of psychoactive or the part of marijuana that kind of gives you the high. So people that use it recreationally, that's probably, if you're using it really for the high, it's really the THC that's contributing to that. The other major chemical component is the cannabidiol, and that's the component that doesn't actually give you a high, but tends to be associated with more of the therapeutic effects. So when people talk about taking marijuana for anxiety or pain or for seizures, that tends to be the active ingredient that's most involved. CBD, exactly. So it's the THC versus CBD. So I have to say there's a lot of interest in the autism field and broadly within the area of pediatric mental health. And in a sense, this is kind of an extension of the adult experience, but there's actually some ongoing research to examine specifically whether CBD might be helpful for autistic symptoms, sort of autism-related mental health challenges, particularly irritability and anxiety. There are a number of registered clinical trials, which means that there's going to be an effort to actually compare the experience of kids taking CBD versus kids that are not taking CBD to sort of try to distinguish sort of if it's actually having an effect. There are definitely some kind of published papers out there that you can read about where it's sort of more of a trial basis. It's like, we'll see what things were like before starting the CBD, and then we'll see what things are like after. I mean, any study like that, it's always hard to know whether the changes are related to what you think you're studying or whether they're related to other things going on, like the therapies or educational programs and other types of supports. At this point, the emerging evidence from these kind of pre-post studies are that CBD is relatively well tolerated, with some relatively sort of modest side effects like the increased sleepiness and increased appetite, not surprisingly. And I think the consensus in the field is that there's justification to have a closer look at this. So on one hand, there is actually some kind of promising experience that there may be the potential potential for benefit. I think there are huge caveats that apply here and to a couple other things that I'll talk about. And that is what might be available through a research study may be very different than what's available, not only sort of through, through the dispensary, but even through the pharmacy. And the reality is that marijuana is not actually, for the most part, sort of distributed by prescription. I mean, now you can, but even the products that are available by prescription are not regulated in the same way that other pharmaceuticals are regulated. And in particular, it's actually very difficult to know, despite what's on the label, what the balance is between CBD and THC. You may think that you're offering, that you're either taking or you're offering to your child a product that's almost exclusively CBD, but when people have actually sort of taken those products to the lab to measure them, there's huge variability, and there isn't sort of one particular company or label that one can really rely on. And then sort of this broader concern that on one hand, there's this emerging evidence that sort of relatively pure CBD may offer some modest benefits, but then there's sort of this much longer research base around use of marijuana in individuals, particularly under the age of 18, and sort of what the long-term risks may be. Okay. All right, shifting gears into something not remotely less controversial is autism and stem cell therapy. So the idea is that we have these sort of stem cells or cells that aren't kind of fully differentiated. So have this potential to there are these sort of these cells that at an early stage of development could become muscle cells, could become skin cells, or could become brain cells. So I think there's been a lot of interest in stem cells in medical treatments. I think a lot of the focus has been in areas of injury, particularly spinal cord injury, where there really aren't other than rehabilitation, there isn't hope currently for sort of, repair of spinal cord injury. And therefore, there's been a lot of interest in the potential for targeting and helping those particular cells regenerating in a way that it sort of rebuilds the injured area of the spinal cord by forming new nerve cells. And that's probably the area of stem cell research that's best established. It's still considered an experimental treatment, but in that area, there has been some clinical trials. There's also been interest in other areas of developmental medicine, particularly for children with cerebral palsy, where our understanding of the condition, at least in some cases, is related to a brain injury, like a stroke that might occur before birth or a subsequent injury. And again, unlike spinal cord injury, there hasn't really been clinical trials yet in cerebral palsy. There's been a few sort of pre-post studies, as I talked about for CBD oil. And then in autism, there's a lot of interest, and there's one center in particular that's reporting on a trial. So I should say that kind of reading sort of a general updated review, there are actually about 12 registered trials of stem cells in various forms in treatment of autism in either adults or kids in the States. Some of these trials have actually been finished, and then the researchers kind of disappear. So there's sort of evidence that this trial has completed, it hasn't been reported or discussed publicly, and it sort of leaves some open questions. Probably the most visible group that's pursuing this is a group at Duke University that's supported by both industry as well as pretty substantial private funding from a group called the Marcus Foundation. And one of the senior members of the team is actually Geraldine Dawson, who really is a leader in autism research for many years, was someone who really helped us understand the early phenotype, kind of early development in autism. She was part of kind of our Baby SIBS research consortium for a number of years, and in general is regarded as a credible researcher in autism. She also knows a lot about brain development. So in this trial, they've gone through sort of a few phases, the first of which was establishing whether it seems to be safe to kind of offer stem cell treatments. Now, I want to be really clear here that there are many ways of giving stem cells, and in this particular trial, they're using the child's own kind of cells that were harvested from their umbilical cord when the baby was born. So as many of you know, sometimes, in the delivery room, parents are actually given the option of banking stem cells from the umbilical cord. And there is a variety of ways that happens. And, there's a lot of controversy about whether, sort of if you just sort of do this from a community hospital, where those stem cells actually go, like whether the refrigeration regeneration is adequate and whether there's are still functional cells. But for this particular group, that they had usable cells from their own kind of umbilical cords that were sort of re-infused. In an initial study, it didn't seem to have major side effects. There seemed to be some promise in terms of the kids who got the stem cells seemed to sort of show some progress in their independent skills pre-post, again, not with any controls. And in this most recent study, again, sort of uncontrolled, there was some evidence that the kids who got the stem cells were doing a little bit better in their language skills, a little bit better in their independent skills, and also that they did brain scans and showed some evidence that the connections that they were studying in the brain, and connectivity is an area of interest in autism research, and there's sometimes concerns that the kind of connections between distal areas of the brain are not as well developed in some people on the spectrum versus others. They found some sort of very modest evidence that the connectivity also improved. They couldn't really comment on the mechanism, and in fact, the paper itself kind of emphasized more the anti-inflammatory effects of other cellular components of the cord blood, as opposed to actually stem cells sort of going to a place in the brain and starting to regenerate difference. So it's, so on one hand, this is a relatively credible group. I mean, certainly working with a lot of industry funding, but publishing their findings. On the other hand, a lot of reservations from the scientific community. And I think that the two major reservations are, first of all, it's potentially a bit of a shot in the dark. Like, we don't know quite what happens if you infuse stem cells into the vein. Like, do they actually go into the brain? Do they sort of find the right location? If we understand autism as a condition that is actually more about brain development than brain injury, how might this work? And what's the relative importance of inflammation versus actual regeneration? And scientists have commented on this sort of with caution, but an open mind that this is worth exploring. I think the bigger concern that people have highlighted is that outside of a trial like this, you just don't know what you're getting. I mean, bottom line is that stem cells are considered a blood product. I mean, if one goes to a private clinic or another area of the world to sort of access these treatments, which otherwise are actually very difficult to access, you really don't know what you're getting and sort of what the contamination might be, what the difference might be getting your own cord bloods versus getting some other cord bloods that are essentially, might be harvested just from the delivery of another infant. The parent kind of signed a consent to have the umbilical cord saved. They've kind of banked it, but you don't know anything about the circumstances. So I think there's a bigger concern around the risks to families that sort of explore options outside of a trial like the one that's ongoing at Duke. I mean, the other related issue is cost, and I'm aware that even for people who go to a research study like the one at Duke University, there are actually a lot of costs associated with it because families are responsible for their own travel down to North Carolina. There are multiple visits involved, and even some of the assessments and follow-up, even though it's a research study, are not actually funded by the research study. So parents are out of pocket for several $1,000s for each visit. But again, it's not like to sort of set this aside as not something that potentially has something to offer. And the whole dogma that we can't somehow treat the underlying of biology of autism is kind of, we're done with that. Like, gone is the times that we're saying that we might be able to use medication to treat the secondary things like sleep or aggression. And there's really serious discussion about, we're learning more about the biology of autism, even though it's something that happens early in development. Can we actually sort of kind of change things sort of later on? Finally, I'll talk briefly about diet. Honestly, I hope I'd have something kind of brand new to share with you, but the evidence that's come out over the past couple of years hasn't really been much of a game changer. Probably the most common diet that individuals on the spectrum and parents will try is the gluten-free, casein-free diet. There have been a handful of clinical trials that suggest that people on the diet tend to experience a feeling of well-being, but when it's compared to people who think they're on the diet but are not actually on the diet, that they experience sort of very similar kinds of benefits. This was an interesting trial over the last year in that rather than starting people on the diet, they actually went to people that were already on a gluten-free diet and essentially took some of them off. Again, sort of masking, the meals kind of look the same, but half of the group got meals that actually contained gluten, half the group continued on a gluten-free diet, and there were really no differences that individuals or families were able to report. kind of one interesting kind of twist on diet that, again, is at a pretty early stage, is actually something that's derived from broccoli sprouts. So there's a chemical called sulforaphane that actually gives broccoli its flavor. It's more highly concentrated in sort of like the little broccoli shoots. Like you go to the farmer's market and kind of pick up the shoots rather than broccoli. It's an antioxidant, and there have actually been a few trials that, again, and in this case, actually a trial that actually had a control group that actually suggested that there were modest effects on behavioral symptoms, and there's ongoing research. I mean, in contrast to stem cells, it's probably, it's actually broccoli sprouts. You can extract it and put it in a capsule, but you're basically eating your broccoli. So it may have some appeal both in terms of safety and in part of. And hold on to the question just because we'll come up to the panel after in just a moment. So bottom line with what I've talked about here, so I'm not going to stand up here and say that this is like way too out there, that these are treatments that should never be considered. I mean, I think we all have to keep a very open mind, and as we learn more about the biology of autism, accept that there may actually be treatments that sort of fundamentally change sort of what's happening in the brain and potentially sort of offer some promise and hope for improving symptoms, improving function. Bottom line with CBD, we don't quite know yet, and it's actually hard to find pure CBD. Stem cells are at a pretty early stage. Not a whole lot new with diet. I hope to talk about the ketogenic diet too, but the truth is there haven't been any clinical trials of ketogenic diet at this point, and rather it's much more about sort of personal experience. And I think in general warrants a cautious approach kind of for everyone considering any of these treatments to just be kind of go in with one's eyes open in terms of potential benefits and risks. And again, sort of as a reminder for me and my colleagues sort of working in the medical fields, that to kind of enter these conversations with very healthy respect, to sort of kind of share information, but ultimately empower people to make informed decisions. Okay, so with that, I thank all of you for your interest, and I'll invite David back to the stage, and we'll take questions for the 3 talks this morning. So thank you. Are we going to play?
Yeah.
We are.
Yes.